I'm talking about the coronavirus pandemic and the lessons that we can learn from the tragedy being played out in the UK. I'd like to start with the words of Lancet editor Richard Horton, who recently said the following: "Coronavirus is the greatest global science policy failure in a generation. Austerity blunted the ambition and commitment of government to protect its people. The political objective was to diminish the size and role of the state. The result was to leave the country fatally weakened. The impact of failed policies of the last 10 years has undermined the ability of the NHS to respond to the COVID-19 pandemic. There's the ideology of the free market that has divided and weakened the National Health Service. There's the decimation of social care. There's the vicious, hostile environment that has ended universal access to the NHS. And there's been the cruelty of universal credit. All of these have added to the damage done to the NHS to endanger our entire population facing this national crisis. How and why did our government respond to the crisis in the way they have? Just going over the timeline very briefly, in January, it was very clear that a dangerous new coronavirus had emerged in China. And on the 23rd of January, China locked down Wuhan city in Hubei province and other cities. So the UK government and Public Health England has had 2 full months to prepare its response between then and March. On the 30th of January, the World Health Organization declared a global emergency, a further warning of what was to come. The very next day, the first cases were detected in the UK. And a month later, the first person-to-person transmission within the UK was noted on the 28th of February. Initially, public health classic measures were followed: testing, rigorous contact tracing, quarantining of all of those. But for some reason, that was quickly ended and has still not yet been brought back into operation. On the 11th of March, the World Health Organization declared officially the pandemic. A few days later, the Imperial team made available its famous pandemic modelling paper, which warned that if the UK did not change its policy, it was facing at least 200,000 deaths on the do-nothing scenario. The UK government responded in somewhat of a panic and announced the next day, 24th of March, a 3-week lockdown period, which has been renewed on the 16th of April. Parliament was then suspended on the 25th of March for a month. So we'd already started to make mistakes, born in significant part out of arrogance and ignorance. The arrogance of setting aside World Health Organization advice, the arrogance of failing to learn from China's response, where out of the facing tragedy, they responded and rescued the situation. We failed to learn from Germany's response, who heeded the warnings of WHO, saw what had happened in China, and immediately instigated rigorous public health measures to control the outbreak. In the UK, we abandoned public health principles. There was talk of herd immunity. There were reports of Dominic Cummings chairing a health emergency meeting, supporting the concept of herd immunity, making comments about acceptable numbers of old people dying. I doubt whether Matthew Hancock understands the principles of herd immunity, but let's just have a brief discussion about what they are. Herd immunity, in principle, is usually talked about in relation to vaccines. Vaccines that are covered by 80% of the population afford some protection to the 20% uncovered by vaccines for whatever reason. They don't want them, or they haven't, or they're too young, or they've got health conditions. though the 80% vaccinated will afford some herd immunity to the rest of the herd unvaccinated. But it's a very different scenario, very different significance in relation to a fatal illness spreading through the community. To acquire herd immunity for coronavirus, 60 to 80% of the population would need to be infected and need to have acquired immunity, which we still don't know will emerge. 60% of our population of 66 million is 40 million people. Now we know the mortality rate is about 1%, and so 400,000 deaths in theory could emerge from this herd immunity scenario. Someone thought that that was a price worth paying in order to keep the economy open. Another round of ignorance has visited itself on our community. The ignorance of the reality of people's lives, the dangers of people living in care homes and vulnerable to the spread of infection, the vulnerability of care workers themselves without adequate protection, zero-hour contracts and the pressures on staff who are one paycheck away from starvation or losing their home, going into work when they're not feeling well, or when they should be self-isolating if they've been in contact. The dangers for bus drivers in the rush hour with people pouring onto the front of the bus and asking for exchanges of money. The importance of free school meals and breakfast for many children in poverty. If schools are closed down, they lose that. The dangers for teachers if schools remain open or are reopened without serious public health measures and, if needed, public personal equipment. The result, sadly, has been a mounting tragedy that this pandemic has brought to the UK. On the day I'm talking, over 20,000 deaths have already occurred, 16,000 of them official figures from hospital deaths, but today 7,500 community-based deaths are talked about. Hospital deaths alone are 4 times the amount of deaths per population in Germany. But we're also seeing the tragedy of the deaths of key workers. Today, 96 NHS and care staff deaths have tragically been reported. And at least 21 transport workers in London alone have died due to their vulnerability of being on the front line. Care workers, teachers, emergency service workers are all in danger of losing their lives. There's been a failure to provide the testing around the country adequately. There's been a failure to protect key workers with PPE. There's been a failure to even identify who are key workers. Beyond the NHS, which is obvious, care staff are key workers, teachers are key workers, supermarket staff, transport workers, delivery drivers. We have to redefine what is important in this society. We have witnessed daily government briefings for weeks with claims to be ramping up testing and the provision of personal protective equipment, but they failed. Matt Hancock and the government continue to fail the very workers that they are clapping weekly. Top-level arrogance and ignorance have denied staff safe PPE and testing and worsened the risks that frontline staff face when serving the public. How on earth could we get it so wrong? There have been serious errors of judgment, but we've also been starting from a disastrous place with a damaged NHS. This tragedy is compounded by the impact of what happened to the NHS and public services over the last 10 years. The weakest links in the NHS and other services exactly mirror the most ignorant, vindictive, and ideological of the policies of our political leaders. The NHS is so short of beds. 17,000 beds, however, have been cut since 2010. We're short of ventilators with only 5,000 at the beginning of this crisis. Yet Germany's starting point was 29,000. So we've had to erect emergency Nightingale hospitals around the country. We started off with 100,000 NHS staff vacancies, short of 122,000 care staff vacancies. hence the emergency call for retired staff to come back to the front line, even if they have risk factors like their age or other conditions. 750,000 volunteers have come forward, but they've not been used properly by the government because there was no planned response to allocate them to sectors where they're needed and to give them the adequate training. There's the inefficiency of the private-public divide in the NHS. Now, we've needed the capacity from private hospitals, but we're compensating them with £2.4 million per day, £300 per bed per day for the duration of the crisis. That shouldn't happen. Private competition has already undermined the strength and the morale of the NHS as a public service. And with the Health and Social Care Act in 2012, private capacity within the NHS hospitals has been ramped up. Although the NHS can use that capacity now in this crisis, that has damaged the NHS as a public service. And additionally, a lot of NHS staff in their thousands are working part-time in private hospitals. I would like to know now if they are fully available for NHS work in the front line to respond to this public crisis. There's also been a serious attack on public health resources. Austerity has dealt severe cuts to the very public health service in this country that we're now relying on. How irresponsible. Public health teams in local authorities and nationally have been stripped back. But so also have staff groups that could have come to the aid of a public health mobilisation, like school nurses, health visitors, community nurses and other groups. There's been contempt for science-led pandemic planning. Under Jeremy Hunt's period of office, there was the 2016 exercise Cygnus. That was a pandemic modelling exercise, and it came up with really important findings. A warning that PPE stocks were dwindling, a warning that face guard masks were going to be needed by frontline staff to protect them from a pandemic. The lack of hospital beds and ventilators was noted. All of those recommendations were ignored because the government said they could not afford to meet the cost of them. And the hostile environment, repeat this, has ended universal access to the NHS at the very point in time when it is unsafe to drive people away from NHS care out of fear. Migrants and undocumented people, including 120,000 children, have learned bitterly that they are to be fearful of going to the NHS if they are then going to be reported to the Home Office or given unpayable invoices. Even though coronavirus is a notifiable disease and treatment is free for all people, they have learned to be fearful and have stayed away from the NHS with, in some cases, fatal consequences. And that endangers themselves and endangers the community in the middle of a pandemic. The government made a late response with lockdown almost as a panic measure on the 24th of March. But they did not then, and they still do not now, have the basic testing, contact tracing, quarantining that they need to be developing a safe public health response. So we still have a lockdown being played out day by day, now extended, but still no response that will defend our community in the longer term. Other actions that the government has taken are quite interesting politically because they reflect the barriers that emerged resulting from previous government policies and legislated for in the Health and Social Care Act. For example, in this national crisis, we need national procurement policies. Procurement for equipment, from PPE to ventilators, needs a national mechanism to respond quickly. NHS England still runs the company NHS supply chain, but the workings of procurement has been heavily outsourced and a national response has been fragmented and a failure. The NHS also needs to make national decisions about how to use our health services in local areas. That is against the legislation of the Health and Social Care Act, which gives local CCGs the control over commissioning decisions and how NHS services are used. So NHS England has been forced to take back the right to award national contracts and to give directives to local CCGs affecting local health services. That is the right decision, but it is in spite of the Health and Social Care Act. There's also been a decision to set aside the long-term plan for the duration of this year. The plans to divide the health service up into 44 areas. Funding is another area where the NHS has been struggling with an artificial burden on it of being accused of being £13.4 billion in debt. Suddenly now the government has decided to write that off because they do not want the NHS trusts to be making the wrong decisions to guard their balance books. And they've been told to set aside cost savings targets and cost improvement programs and to spend what is needed. That also is the right thing to happen, but it exposes how wrong previous policies have been. The question now is, where do these events leave the Health and Social Care Act and what will emerge? Will we have a highly centralised, commercialised NHS structure that retains the purchaser-provider market, retains the assertion that market competition will give us a more efficient NHS and continues to damage our NHS as a result? Or could we see some of those changes that have been put in urgently to be built on to return to a publicly funded, publicly managed, publicly provided NHS, and to go further and demand a national social care service? What we need now is delivery of urgent equipment and testing, not assertions that they're ramping up. We need basic public health measures put in place to have the long-term safety of the community assured. And if a lockdown is to be lifted at all in the coming weeks, that has to be in the context of active testing, contact tracing, strict quarantining, and safe equipment. Keep Our NHS Public has our 6th demand petition jointly with the Socialist Health Association, and we would call on everybody to continue to support that. We demand the obvious testing and PPE for all, but we go further about outsourcing. We're demanding a living wage and demanding the right to full sick leave if outsourced staff are sick or they need to self-isolate. We call on the government not to reward private health companies for resources that the NHS needs in response to public need. We demand the government makes fully available the information that they're using to make their decisions and have that publicly scrutinised. We call for an immediate end to the legislative barriers to accessing the NHS faced by migrants and the undocumented, and end eligibility checks and charges. And finally, those people needing carers for their personal care, relying on packages of support where they are organising their care. If those carers are ill, we demand priority support for those disabled people. In future, we need to learn the lessons now and plan for change in the NHS. We're facing a huge tragedy, but there is an opportunity to build on here, partly to respond better now, but to build a safer NHS and social care in the future. There has never been a higher profile for health and social care. Richard Murphy is a commentator on political economy and a tax expert. And the things he says need to happen are threefold. First, the renationalisation of the NHS. There is no longer time for the farce created by the fracturing of the NHS by the so-called internal market. It has simply created burdens that must be swept away now. Integrated care and systems are essential from now on, and I would add they have to be fully in public hands. Secondly, the NHS needs proper funding in the future. And third, PFI debt needs to be brought in and cancelled for good. This disaster has to be consigned to history now. He said that in the Lowdown online journal. In more detail, we need to demand the formal ending of the Health and Social Care Act that the government has had to some extent work around in order to respond properly to this crisis. We need to put back together a national NHS. We need to abandon the long-term plan permanently and end the breaking up of England into 40-odd commissioning areas. We need to abandon commissioning and the purchaser-provider split and privatisation of clinical services. And we need to go further to end outsourcing of ancillary services, cleaning, catering, portering, etc. Those areas of staff are now regarded quite rightly as on the front line and key workers. Outsourcing is a huge risk. Agency staff can be sent from pillar to post, from hospital to hospital, from care home to care home. And in this pandemic, never has that been shown more clearly to be a nonsense. We need to recognise the artificiality and the damage done to NHS hospitals and community services to be constantly accused of being in debt. We need to fund the NHS fully. We need to fund and fully integrate in public service NHS and social care. The links have never been clearer. The interdependence of health and social care looking after our community. Coronavirus is a tragedy. The response is a political scandal. But out of this, we need to seize the opportunity to learn from these mistakes and call on the public to demand a return to a wholly public national health service and to create a wholly public national care service. Thank you.